talk about something else that I've been hearing about and learning about. I'm hearing that a lot of healthcare workers have described those very long, frequent shifts as being comparable to war zones. Um, Witnessing the direct effects of trauma that the pandemic brings as it's literally spreading through communities, not just through communities, but families first, entire families being impacted by the virus and then spreading further through communities. That's gonna result in trauma. And that prolonged exposure can have very negative effects, as you know, on one's mental health. How can frontline workers find relief from that? Do you have any tips?
I think overall there is like this guilt that you feel, right? If you imagine, you described it as being in a war zone. I've never served in the military. I've never served in the military, but I imagine you can't go off and say I need a day off, when you're in the middle of fighting, right? And so that's how we feel a lot of times on the floor. It's, when I get, text messages or emails that we're short staffed, a lot of times you're thinking, can I stay over? Can I come in for a couple hours to help? But it's important to know that like self care in this time is very important, right? And so a lot of times I tell people, even if you're working on your lunch, try to leave the hospital and take a walk on your lunch. Try to eat your lunch outside
Mm.
on your days off. Make sure that those really time for yourself to recover. It's a day off. So if that includes, turn off your phone or turn off the TV or whatever you need to do, that's really areas that you could do to get relief and practice self care.
Wow, wow. Talk about any support groups. It occurred to me that there may be support groups that have come out to help support frontline workers as they're dealing with this pandemic. Maybe the gathering itself might be virtual, maybe in person, but just so you can show support for each other as you're doing this work. Are you familiar or aware of any groups like that? Does Capital City Black Nurses Association have one, for instance? What do you know about it?
So I know that many groups have kind of popped up on our social media apps, right? Now we're now finding that social media can bring some support, right? It's an area that's a little bit bigger than posting gender reveals or sharing recipes, and so we're now able. A lot of times, I'm invited to these groups where it's nurses from all over the state or over the country, and they're just passing along information, using it to connect or how they're feeling. CCBNA specifically, we call it Self Care Sunday, and
Hmm.
so we use that as kind of like a healing circle.
Wow.
And we got the idea from my hospital, which had implemented like healing circles around the pandemic to get different healthcare workers together to discuss their feelings about what's going on and their stress levels the stressors at home or in the hospital. And the event that CCBNA threw every Sunday actually began to be more important and actually evolved after everything that's gone on, like the events of the George Floyd, where it was an intersection between race and nursing, where often we're in the hospital dealing with COVID, and sometimes some of the conversations that are happening at the nurses station may be triggering other emotions, right?
Wow. Wow. I can't. I didn't even think of that. I just pretty recently found a notation that CCBNA posted your response to the George Floyd issue, and it that just hours ago reminded me about that intersection, and hadn't even thought about it before. Hadn't even thought about it before. I want to ask you about another study, the mental health of healthcare workers in COVID-19. It revealed that almost 40%, I was struck by that number, of surveyed healthcare workers stated they were more likely to smoke, more likely to drink, and more likely to use substances to deal with the stress that has come from this pandemic. It's led to insomnia, headaches, a number of upsetting thoughts. And these are the same co occurring behaviors, I believe, that we see in mental health, particularly with mood disorders. Can you speak to that? Have you seen patients that are actually they're using substances more frequently and maybe less appropriately, and it's leading to problems down the line?
So these are some habits that are like maladaptive coping mechanisms, and so definitely you'll see that in the general community and in nursing when you're dealing with stress and anxiety, depression, surrounding the high stress work environment, the social distancing. Um, There's other stressors such as, childcare issues that a lot of people are having since we're having to do distance learning.
Yeah.
Nurses are parents too, doctors are parents too. So we all have to kind of think about that. And then also the stress of maybe having a spouse that's out of work. So this all kind of adds to reasons why people go to smoking and consuming more alcohol. Um, so the question is, what can a hospital do specifically for healthcare workers, right? And so interventions that we have at my hospital, because I can only speak at for my facility, is we have one-on-one therapy, we have one-on-one crisis intervention, and they could work by like in our facility we have a peer support group, and that I think originally came out of the PICU, which is the pediatric ICU, and it's kind of those services has been available hospital wide. If you're having some crisis related to maybe a patient dying or anything like that. I know also what's helped in our hospital is the leadership visibility and transparency. So what
Mhm.
is it that we're doing? What is the hospital doing, right? And we like to see leadership on the floor, walking around, in the elevators, going around checking on people, and that's really helped with some of the stress, release some of the stress. Also, having a channel for communication, especially on the units that specifically are that primarily see COVID patients. So a place where you can voice your questions, your concerns, also really helps with that.
I think that's good to hear that you've got those systems in place to help with that, Aaron.